The Act also provides for coverage of contractors, some contractors. Health centers use a lot of contract providers, and the 1995 amendments to the Federally Supported Health Centers Assistance Act added a section to provide coverage for contractors. So, any full-time contract provider can be covered, and the definition in the statute is over 32 and a half hours per week is a full-time contract provider. In addition, Congress said that part-time contract providers can be covered if they provide family practice, OBGYN, general internal medicine, or general pediatric services. So let's look at some examples of that. If I have a part-time nurse midwife, he or she can be covered. Okay? If I have a part-time family practitioner, he or she can be covered. Contractors, that is.
What about the hospitalists? That the health centers contract to see our patients in the hospital. Now, they presumably have their own malpractice insurance through the hospital. If they're seeing our patients, are they covered under this?
They can be. They could be. It's possible. Yeah, it depends upon what service they're providing. Most of them, a hospitalist would probably be an internal medicine physician, I would guess, or peds. And if they're a part-time contract internal medicine physician or part-time contract pediatrician, seeing your patients, they could be covered.
But they would be working for the hospital.
That's
so
the question. The question is, who is the contract with?
Right.
Am I contracting with that physician or not?
Right.
Or am I contracting with a hospital?
So we have an agreement with the hospital service.
If you looked at my last point on here, contractors, the contract must be between the deemed entity, the health center, and the individual. A lot of cases with a hospitalist, you're not contracting with that hospitalist. You're contracting with the hospital. So then there'd be no FTCA coverage, even though it's a part-time contractor providing internal medicine. The contract has to be between the health center and the individual providing the service. So if you have a contract between a health center and a corporation of any kind, there's not going to be FTCA coverage for those people under that contract. Okay. Let's talk about part-time contractors some more. If I have a part-time contract dentist, what's going to happen? I'm not going to have any coverage. Okay? Not one of the 4 services that Congress felt belonged in here. And why they didn't include dentists, I don't know. Dentists always call and ask, why didn't they include me? I don't know. But that's the case. If you want to cover a part-time dentist, make them an employee. Then they'll be covered, because we said all employees are covered.
So if someone is a specialist, like endocrine or something else, like they're part-time, they're not covered?
That is correct. Any part-time contract specialist is not going to be covered.
But full-time is covered, right?
Full-time contract specialists can be covered if the service they provide is in your scope of project.
But if they get a W-2,
if they get a W-2,
and they would be covered.
If you get a W-2, you're covered. Remember, the next caveat we're going to get to is scope of project, which is another limitation on everything. The actual statutory language is up here now. G1A says that any contractor of such an entity who is a physician or licensed or certified healthcare practitioner. And so a corporation can't be a licensed or certified healthcare practitioner. So that's how, that's one part of the statute that was interpreted to mean you can't contract with corporations. And then later on it says, when talking about coverage, it says an individual may be considered a contractor. So we thought that was pretty clear. To be covered as a contractor, the contractor has to be an individual. It can't be a corporation. So, if I'm a health center and I contract with Dr. Smith's PC, I'm not going to get coverage for that because I'm contracting with a corporation. Right? So the contract has to be written between the health center and the individual The payment must be made to the individual. You can't issue checks as a health center to the corporation. And the 1099 that you issue, the IRS form 1099 that you issue at the end of the year to the contractor, has to be to the individual. I've seen cases where you've had a contract signed between the health center and the individual, but the payments in the 1099 were made to the physician's professional corporation. Well, the lawyers and general counsel are smart enough to figure that out, and there's no coverage there.